Welcome to this video on First Aid HSE training, presented by Ellen Nicodemus. We will cover essential guidelines for managing basic emergencies. The primary objectives of first aid are to prolong life and alleviate suffering. Remember, a first aider's responsibilities end when professional medical care begins. You are not there to compete with medical professionals. Accidents can happen even with the best preventative measures. When an emergency arises, time is critical. Beyond a well-stocked first aid kit, your preparation and skills are the most important tools you have. A comprehensive first aid kit should include essential items like sterile bandages, gauze, antiseptic, scissors, tweezers, gloves, and basic medications like pain relievers. For open wounds, follow the 5 C's. Clean the wound, control bleeding by applying pressure and elevating the limb, cover the wound, provide care for shock, and call a physician. When cleaning a wound, use mild antibacterial soap and water. You may use sterilized tweezers to remove remaining debris to reduce infection risk. If debris is difficult to remove, seek medical help. To control bleeding, apply gentle continuous pressure with sterile gauze or a clean cloth until the blood clots. Elevating the injured area above the heart can also help. Avoid applying hydrogen peroxide directly to an open wound, as it may irritate living cells and delay healing. Instead, use an antibiotic ointment like Neosporin and apply hydrogen peroxide only around the wound if needed. Always cover the cleaned wound with a bandage or sterile gauze to keep out dirt and bacteria. Be sure to change the dressing frequently and keep the wound clean. If a victim is in shock, lay them down with their head slightly lower than their chest and their feet elevated. If bleeding is profuse or the wound is deep, call a physician immediately. Puncture wounds may appear minor because they close easily, but they carry a high risk of infection. If caused by a dirty object like a nail, consult a physician about a tetanus shot. Treat all bites from pets or people as serious. Clean the area thoroughly and seek professional medical assistance. If the injury is minor, treat with soap and antibiotic ointment, but monitor closely for signs of infection like redness or pus. Shock is a life-threatening condition caused by insufficient blood flow that requires immediate medical treatment. Types of shock include cardiogenic, hypovolemic, anaphylactic, septic, and neurogenic. Shock can be triggered by heart problems, severe blood loss, infection, or allergic reactions. It is often associated with heavy internal or external bleeding and severe injuries. Symptoms of shock are diverse and include anxiety, confusion, pale or clammy skin, rapid but weak pulse, shallow breathing, and potentially unconsciousness. If you encounter someone in shock, first call 911 immediately. Check their airway, breathing, and circulation, and perform CPR if necessary. Monitor their breathing every 5 minutes. If they have no spinal or head injuries, elevate their legs about 12 inches to assist blood flow, keep them warm, and loosen any tight clothing. If you need to place a victim in the recovery position, gently roll them onto their side by pulling on their shoulder and hip. Once on their side, adjust their top leg so the hip and knee form right angles. Tilt their head back to keep their airway open and keep them warm until help arrives. When managing shock, there are critical do nots. Never give the victim anything to eat or drink. Do not move someone with a suspected spinal injury, and do not wait for symptoms to worsen before calling for help. If the person vomits, roll them to the side to prevent choking, using a log roll if a spinal injury is suspected. Burns require different levels of care, depending on their severity. They range from minor first-degree burns, similar to a sunburn, to life-threatening third-degree burns caused by flames or electrocution. Knowing how to identify and treat these distinct injuries is a vital first aid skill. For first-degree burns involving redness and swelling, cool the area with running water for at least 10 minutes. If water is unavailable, use a cold compress. Remove jewelry or tight clothing before swelling starts. Afterward, you may apply aloe vera or a moisturizer and cover the area loosely with sterile gauze. Slide content unsafe. 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 This concludes our video on first aid essentials. We have covered the critical steps for wound care, shock management, and burn treatment to help you respond effectively in emergency situations. Always remember that your safety is paramount. Before providing assistance, ensure the environment is secure so that you do not become a victim yourself. When in doubt, prioritize calling emergency services. Professional help is always the best course of action, and prompt communication can save lives. Keep your first aid knowledge current. Regular training and practice will ensure that you remain prepared and confident when faced with unexpected incidents. Maintain your first aid kits by regularly checking expiration dates on supplies. A well-prepared kit is useless if the contents are outdated or damaged. Documentation is also important. If an incident occurs in a workplace, ensure that the proper reports are filed following company HSE policies. Stay calm during an emergency. Your composure helps the victim remain calm, which is vital for effective aid, and reduces the likelihood of worsening the situation. Communication with the victim can provide important information about their condition. Keep them informed and reassured while you provide aid. Always use personal protective equipment, such as gloves, whenever possible to prevent the spread of infection between you and the injured person. Understanding your own physical and mental limitations is key. Do not attempt procedures for which you have not been properly trained. By following these fundamental HSE guidelines, you contribute to a safer environment for everyone. Your role as a prepared first aider is invaluable. Thank you for watching this presentation. We hope these guidelines provide you with a solid foundation for managing basic first aid emergencies. Please consult your local health and safety representative if you have specific questions or require further hands-on training for your unique workplace needs. Remember, the actions you take in those first few minutes can make a significant difference in the recovery of an injured individual. Stay prepared, stay safe, and stay informed. Thank you for your commitment to safety and for completing this video course.